I've seen patients with terrible x-rays and no pain, and I've seen patients with clean, perfect x-rays who can barely walk. The future of medicine is prevention, not procedures. I'm Dr. Meredith Warner of Warner Orthopedics Wellness and also founder of the Well Theory. What am I talking about right now? False positives. MRI scans are known to have what's called a very high false positive rate. What does that mean? Anytime I look at an MRI, I'm going to be able to find about 20 different anatomic abnormalities, and I can point to those and say, hey, that's wrong with you. But it doesn't mean that it's true. It's a false positive. It doesn't mean that that positive result on the test is associated with an actual disease or actual pathology. Same thing with x-rays. And I can tell you that to date, and this is the year 2025, we have yet to have a study that accurately or definitively correlates anything we see on an x-ray or an MRI or CT with how somebody feels. It just doesn't happen. So when somebody points to an MRI and says, you have a disc, you must have surgery, maybe sit back and remember what I just told you. Think about it and say, doctor, could that be a false positive? Or something like that, because it probably is, odds are, based on the statistics in the literature. And remember, I've seen people that are truly bone-on-bone on x-rays that have absolutely no pain. So even if you do have a massively positive finding on an imaging scan, it doesn't mean that you have to hurt. You can still manage it non-surgically in all likelihood. I invite you to come see me and my team at Warner Orthopedics Wellness, because we understand that things are false positive, we understand that people can heal well, and we understand how to treat orthopedic conditions naturally.